Imagine a mobile-first, smart room native, built for where the nurse is working and how that nurse works. And it doesn't have to be where the EHR is. That's our vision.
Try to fix the current system or reimagine something new. Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about how consumer health works. We spotlight how healthcare is being designed, marketed, and delivered from the consumer point of view and profile leaders who are championing the move to preventive care. If you want to understand healthcare both as a builder or operator and as a consumer yourself, this is the place for you. Here's what's going down today. First up, we have the Flava of the week about Reach3's new consumer health survey. What does the survey say about the use of digital health and wellness tools, and how does it help us to look at the data through the consumer lens? I'll talk about that. Then we welcome Varghese Presti, Corporate VP of Microsoft Health and Life Sciences, to discuss where consumer experience, nursing, and AI are colliding to create some interesting tailwinds for patients and clinicians. I'm Jared Johnson. Let's get it. Flava of the week. Americans are increasingly interested in digital apps and devices to help manage their health and wellness, and they intend to continue using these digital tools into the next decade. That's according to new data from Reach3 Insights compiled from a survey of more than 1,000 U.S. adults at the end of 2025. The survey found some interesting data points. For instance, 70% of respondents use health-related apps. 64% of respondents use health-related devices. Digital health tools are being used to track biometrics, physical activity, and sleep most commonly. These health tools are varying by age group, with Gen Z using health tools for sleep tracking, millennials using them for physical activity tracking, and boomers and Gen Xers using them to track biometrics. Gen Z also uses fertility and women's health apps as a group. More respondents use holistic wearables for comprehensive health metric tracking than fitness-oriented wearables. Survey respondents also expressed preferences for future use of digital health tools. For instance, there's interest in smart rings from 39% of respondents, which is up from 34% in the past year. Interest in other digital health devices includes fitness-oriented wearables, holistic wearables, smart home devices, and smart glasses. The ability to track progress over time, get accurate and measurable data, and easy use and convenience were the most desirable parts. While Americans are showing a preference and desire for digital health apps and devices, the survey also found decreasing interest in digital healthcare services like telehealth visits and online direct-to-consumer pharmacies. What's the consumer lens? It's a positive step to say that Americans are embracing digital health tools with self-reported surveys. Just keep in mind that response bias. The data is based on what respondents say, which may or may not accurately represent how they behave. It's also important to remember that we tend to look at data like this through the bias of our own experience. If you've tended to have good luck with digital tools in the past, there's a good chance you're more likely to report positive interest in using them more. Likewise, if you likely have had negative experiences in the past, that's likely to color your response. So consider that as you factor this data into what you're building. But even accounting for those biases, we're clearly seeing momentum in consumer health. It's up to you what comes next. Let's look at consumer health tools knowing that there's a resurgence of momentum behind them and always evaluate data through the consumer lens. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. All right, everyone, let's get into the flow. Please join me. My guest this week is Varghese Presti. She's the Corporate Vice President of Microsoft Health and Life Sciences. We have a lot to get into, Mary, but first off, welcome to the podcast.
Thanks, Jared. I'm delighted to be here.
I think our audience will benefit from hearing a little bit more about your background and giving them a little bit more context. And the way we've been asking guests lately to do that is to share how they would boil down their philosophy about healthcare into like a core belief, like one or two core beliefs. Tell us like kind of just your perspective on healthcare.
My perspective on healthcare, and this is coming from having worked inside it as a pediatric nurse as Johns Hopkins, and then working kind of on the healthcare system at large from a policy perspective. And then kind of getting a little bit of an experience in, sort of corporate healthcare America in big pharma. And then really for the last back half of my career so far in tech is we have a fragmented healthcare system that has been fragmented since I graduated from college and have started working in it. We've made progress, but having a wonderful experience that's integrated where all the right information is flowing and patients can actually navigate in ways with a sort of bar for expectation and experience that we have in every other facet of our life is still not here over all of these years. And it's not for lack of trying. And so it just continues to elude us. And so patients are getting sicker, clinicians are getting more burnt out. Patients are, there are real outcomes. There are real consequences to us not fixing the healthcare system, and costs are going through the roof. And so we're at a moment which is really exciting. This right now, this space that we're in with AI, this is a generational shift in technology for all of us. And so my philosophy is really, all of the clinicians, all of us as patients deserve for our health system to leverage every lever and every tool set that it has to make healthcare the best delivery system that we can have in this nation. And so I'm super excited about where we are, the possibilities ahead of us, and there's a lot of work to do.
I think that'll help set up our discussion here because I want to dive into scaling AI in health systems in particular. Where do you see health systems getting it right? When they're trying to scale AI across their organization, where do you see them getting it wrong?
Well, let's take a moment to talk about it because it looks a little bit different depending on what we're talking about, right? And so where we've been focused extensively is AI solutions for clinicians. So physicians, radiologists, nurses. The most recent sort of effort for us that we just recently launched has been on the nursing side. And we were the first to bring a commercially available AI solution that was purpose-built for nursing. So switching from dictation, as we've had these advancements in AI, to more conversational, that's been a pretty seamless shift for physicians from a change management perspective. So, there are solutions out on the market. We call them ambient scribes, where really a physician can, get consent and start recording. And now the physician and the patient are having their typical encounter. But now the AI is in the background, right? It's ambiently listening, and then it's producing the note for the physician. And now it, of course, all the value propositions have deepened. It does a lot more than just produce the note. That's on the physician side. On the nurse side, it looks very different because the nursing workflow is different, right? So the inpatient nurse, the documentation is different. It's a lot of flow sheet capture. It's redundant and repetitive flow sheets as opposed to more of a narrative note that the physician drafts. So, and then on the radiologist side, they're looking at all of these images and they're reading the images and also producing the note. So there's these different personas, so to speak, that are all clinicians. And health systems, if you think about physicians, nurses, radiologists, and you can keep going down the road around additional personas, these clinicians have a lot of cognitive burden. They need their workload is really backed up. They're spending a lot of time sort of outside of their work time completing the documentation. And when you think about some of the use cases that AI is, really particularly well positioned for, summarization and quickly kind of listening and then creating speech to text and things like that, this is really a nice perfect storm, right? So we start to actually address efficiencies, backlog. What I get really excited about it is with the technology being what it is now, you're removing the technology that has, we've all gotten used to having it be between us as a patient and the clinician, right? Like you've probably experienced you're in a visit, but you're kind of talking to the physician's back because the physician's over here, like documenting and looking in the chart and asking you questions and you're like answering, but you're not really face to face. So this is sort of this is what I kind of think of as the it that I'm going to answer from, right? So I think, when health systems are thinking about scaling this, and that is the phase we're in right now is the scale phase, because I think the last 2 years we had a lot of pilots and experimentation. But the health systems that are getting the scaling of AI right at the enterprise level are the health systems that are thinking about AI deployment, so to speak, as an intensely human change management effort. Right? It's not a software install. It's not a system install. And so first of all, the solutions themselves that will scale well are the ones where they're really embedded in the workflow. The workflow of the solution is very intuitive. We've actually spent the time in reskilling the workforce. The people who are using the solutions, these clinicians, they trust in it, right? Because if they don't trust in it or they don't know how to use it, you'll never get to adoption. And so there's no scale. And then I think it's also really important, at least our experience has been, you want to start with the biggest pain point because a user has to feel like they want to take the time to learn it. They want to take the time to learn it enough to trust it, meaning it has to actually solve a pretty meaningful problem for them. If you're going to start out on some edge case over here, getting to scale is going to be really difficult. And I think the other thing for us anyway, in terms of working with health systems that are getting it right is, and I'll speak from the perspective of nurses because it's more recent for me. It's our latest development. So it's earlier in the maturity life cycle. And so we're at this phase right now in terms of health systems scaling it, right? A big important piece of getting it right is co-designing it with the frontline nurses from day one, right? And so we've had so many examples. I speak as a nurse right now. We have so many examples of where the market has invested in something for physicians and then the health system says, okay, here you go, nurse, you can use this too. And it doesn't fit, different workflow, and you kind of have to suck it up because it's what's been given to you. So that's what's really exciting right now is there are these things that are very much designed for nurses with nurses at the center. And it's not just a design of the solution. The nurse leadership is a really big part of how are we going to design the piloting of it? Now, how are we going to design the scaling of it? How do we design the change management, the training, the measurement of the return on investment, the outcomes that we should be looking for, and having them be all along that journey with us, I think is really key.
What does successful AI implementation look like for a nursing unit?
So we have a Dragon Copilot for nurses. So the inpatient nurse is going into the patient room. You know, when I worked as a nurse, there's so much that I'm doing that's completely in my head and I'm not saying out loud, right? I come into the room, I'm kind of seeing, was the breakfast eaten? Looks like it's half eaten. So, maybe like a little bit of an appetite. I might ask the patient, are you in pain on a scale of 1 to 10? I'm kind of looking at the IV and it looks okay. Nothing is backed up. I'm sort of, as I go around the bed, kind of feeling the feed, okay, good, really good peripheral pulses. I mean, you're doing a lot of stuff when you're talking to the patient, but you're also clocking a ton of observations. So with the Dragon Copilot for nursing, you're coming in, you are talking to the nurses, but you're also voicing out loud your observations. Right. So I might say, hey, Jared, today, what is your pain from a scale of 1 to 10? Looks like your IV is looking okay. Looks like it's flowing. I'm going to, just check your pulse ox. Oh, it's 99%. Like I said earlier, like physicians to go from explicit dictation to conversational, that's actually, they were trained to do dictation. So it's actually easier to go the other way. Nurses who are used to saying, like, just talking to the patient more in an interaction model, but actually clocking all these things and having to say those things out loud is a change management shift, right? But when the nurse is in there, you might go in thinking, oh, I'm going to just pop this antibiotic into the IV, check one thing, and I'll be out. But you get in there and you end up talking to the patient. You're seeing a lot more things because you're narrating it out loud. The solution, by the way, is mobile. So it's on your, phone and it's recording all of these things. When the nurse is done and leaves the room, it looks to see like, oh, all of these different things that it captured based on a number of different flow sheet schemas, right? So here's where we would put like Foley catheter fluid out, how much volume of liquid ingested. There's an I's and O's flow sheet. There's a vitals flow sheet. There's a pain scale field. So it's showing you all the different things that it caught just from speaking out loud when you were in that patient room. And so the nurse can look at that and say, okay, good, click on to the next patient's room. What happens today, though, Jared, if you don't have that, is you go in and you do all the things because nurses always put the patient and the things that need to be done first. And then there's documentation that happens sort of in batches, and it becomes like what you remembered. It's not as like timely and comprehensive as when you're in the room, right? And so what we're finding is the documentation time spent per shift, obviously, because I just mentioned you're talking out loud and then the documentation's done. There's a human in the loop and that you're looking and you agree. You can edit, by the way, if you want to add more pen stuff or change something. And so the cognitive load of having to get to that set of batch flow sheets that I have to at some point get to, but I'm not going to do that over the patient ringing the call bell asking for pain medication. I'm going to give the patient the pain medication. And so the documentation that you have to get to just keeps queuing up and queuing up and queuing up, right? In a universe of like a 12-hour shift. But the other thing that we're seeing is now you're going in and you're seeing all these different things, right? So where I might have gone in and come back out and documented like 8 things, because it's ambiently listening, it's probably, it's collecting like 30 things. And so the total amount of documentation is increasing. The volume of observations is increasing. And if you think about a hospital, or let's break it down to a specific nursing unit. A nursing unit is a system, right? It's a system. There are nurses, there are nurse techs, there's patients. And so when you think about more and more observations from which you can actually now look at pattern detection, and the observations, there's no latency because like as soon as you saw it as a nurse and you spoke it out loud, it's now in the system. It's captured in the system. And there's a fellow over there or an attending over there that looks in the system and sees, oh, I see a pattern here. And the time to action or the time to an intervention now is being moved up so much, right? Because you're not waiting for that batch documentation to then see what pattern are you seeing. This patient is decompensating or, whatever it is. And so there's a real connection to patient outcomes, right? You're just increasing the signal from the noise in the broader system, so to speak, because of the number of observations, how quickly they're filed, how quickly you can see what's actually going on in terms of the full clinical picture. And so how quickly you can actually intervene.
I think you've made a good help to illustrate that really well. Of we say these things, here's what works. We're recognizing how much work it takes to get AI adopted in a certain way, especially with all the correct clinical workflows. Are there other ways that it impacts the patient or a caregiver? Like how else do we show that, I guess, that value?
Yeah. So we have results that show that, health systems do these patient satisfaction surveys, are called HCAHPS. So some of the metrics are like, was the nurse listening to me? Did the nurse explain things to me? So when you think about, in my world back in the day, a lot of stuff I was doing was silent. I was really focused on tasks. And now you're saying stuff out loud, right? You're saying stuff out loud in the room, patients in the room, the caregivers in the room. So there is this like patient engagement that naturally happens because imagine you're lying in that hospital bed and now I'm speaking out loud like, oh, looks like, the toes are, the ankles look swollen. I think the edema is +2. You're going to be like, oh, what's +2? Can you explain that to me? Like, oh, my ankles are, edematous. Like if I hadn't said that out loud, you might just be lying there. And maybe the caregiver, the loved one at the bedside might be like, can you tell me a little bit more about that? So there's better engagement. There's shared, sort of decision-making between the patient and the clinical team. It allows the patient to have more time spent with nurses because the technology is actually giving time back to nurses, right? It's taking the time that the nurse would be spending on documentation and opening up more time and more capacity in that shift to spend with patients. Like I said, the increase in the observations, like I'm saying, the lag between when a signal is generated and when someone can act on it, and closing that gap with AI because of the way that this solution is working and because of the way the documentation is being handled, that's like direct patient outcomes, right? Quality outcomes, satisfaction scores. So when you really step back and you think about a nurse, the nurse role, it's a relationship, right? Like the job of a nurse is to have a relationship with the patient. And that relationship is, you're caring for that patient. There's physical touch involved. There's clinical judgment from seeing those signals and going, oh, something doesn't look right here. I need to, really think about this or call somebody, have somebody come look at this. There's nuance involved, right? Like I know the patient's nonverbal, but the grunts sound different or the shortness of breath. Like I notice that this patient's in duress. Like there's like a nuance of it. There's a tremendous amount of support to the patient's family a lot of times that the nurse is providing, right? So all of these together, you're freeing up the nurse to do all of that, more of that. And if you think about it, Jared, when you're lying in a hospital bed, like, don't you want all of that from your nurse?
Yeah, 100%. And it's interesting with a couple of other conversations we've had recently about whether we refer to, patient versus consumer and all these things. And I think there's an interesting evolution of that conversation, if I can bring it into this, which is a couple of health systems that I've heard of recently that that just dropped from the marketing team or patient experience team. Anyone who's brought in the term consumer, they recognize that it's really easy to kind of lose the clinicians in the room as soon as you start referring to somebody that way. And to their credit, they've just said like we need kind of some shared goals and change management to happen to actually have increases and improvements in a patient experience, whether it's reflected in those scores or not. But whether we refer to them as a patient or not or something else, it's like the thought is you just refer to them however it takes to help us put ourselves in those shoes, to have the empathy that we need so that we can just make some of those improvements and set up any type of tech platform or clinical workflow that is going to get us to that better experience at the end of the day for the people being treated. It's just making sure we're thinking about all of those pieces of this puzzle correctly so that we can get to those things that make a difference. So to your point of like when you're at the bedside, you're feeling vulnerable, you don't want to be there, you're in pain or your family member is, and the more we just factor that in, I feel like to any type of implementation here, we at least are conscious of that. Like I mean, when it wasn't a clinical workflow, we were referring to it as, an end user experience. So this is much more human than that. And I'm glad you brought that part of that into the conversation, because I think it just helps us, kind of keep centered on how it makes it easier for somebody to engage in their health. And those things add up when they aren't in place, when we aren't considering those feelings and those seemingly small things and how they add up, then people don't want to seek care as much. And it's all connected into that individual clinical encounter. So yeah, great.
Yeah,
I just wanted to call that out and just say like, that's a great, like it's important to include that point of view.
I think when we were talking earlier about, you're talking about empathy and you're talking about sort of thinking about it from a consumer lens. So when I was saying earlier about the fact that we started with documentation, it's because we went and studied with real desire to understand what it is like to walk in a nurse's shoes today. And what we saw was that they spend 25 to 30% of their time documenting. Like we saw that. And we saw that like that's not where they wanted to spend their time. So choosing where to even start with documentation as the use case to serve, in this like AI purpose-built solution for nurses is starting with a deep sense of empathy that there is this tax that they pay. There's a physical tax, a cognitive tax, and an emotional tax that if we can start to solve for that, it returns and dividends to the nurse, but also that benefit accrues to the patient, right? There's so many different aspects of just where we are with just this AI transformation, but there's a lot of research saying that I think something like 43% of nurses on the floors these days are expecting to leave the bedside in the next year because of all of these burdens. So if we can start to shift that, right? They went into this field for a reason. There was actually, I think nurse.org released the 2026 survey. They survey nurses and it was called the State of Nursing 2026. That's what it is. And that survey showed that 68% of nurses are still happy they joined the profession. And 81% say that their education was worth it. So despite the burnout, despite, we have workplace physical and verbal aggression that's happening on the floors to nurses, right? Despite feeling undervalued, they still believe in the work, right? And so I feel it is our responsibility, our obligation to build technology that's worthy of that belief, right? They studied nursing. They went into the space. They've been pulled away from what drew them in so many different ways. And so with AI, we really have an opportunity to really restore humanity back into that interaction, enable them to like really restore that relationship. And the way that you do that is giving them back time, but they have to trust in the technology. They have to have gone through the change management so they understand the value they get. And it has to work, of course, as well. But for nurses in particular, they have to also see that there is a benefit accruing to the patient.
When I kind of plug that into Microsoft's broader vision here, what can you tell us about that? Because that's very much the here and now. Some amazing things that are happening in clinical encounters every day. In terms of supporting nurses through AI, like what's the broader vision here?
So there's a couple of different levels of vision. So Microsoft writ large, our vision is that we can help create a shared platform for innovation. So what we mean by that is these different AI models, I'm sure you're seeing this, Jared, like they're aging like ripe avocados, right? Like it's this model today and now it's this tomorrow and it's another one. And so these models, I mean, the answer is not the models. The answer is like, what is the intelligence that you are sort of creating, and what kind of intelligence are you bringing to the clinician at their fingertips? And so when I talk about the shared platform for innovation, we don't believe that any one technology or any one model is going to be the answer. So our approach is to be open, right? We want to be open. We want to open up our platform. So like the Dragon Copilot for physicians, for nurses, for radiologists, it's open to other companies who want to plug in their use cases. Because what we want to do is we want to make sure that the user is not feeling like it's chaotic and there's 30 million things to go to, right? So if they're using our intelligent interaction layer, they can still get the best of the whole marketplace, as their health system chooses. A lot of health systems now are starting to build agents, custom agents that are specific to their health system. So we want to enable that as well. Like innovation is going to come from a lot of different places. And so where we've seen a lot of sort of closed, like I said, I've been in this space for a long time, and for too long, we've seen in health technology, we've been forced into these walled gardens where the clinicians, really spend a lot of their time in what I consider these very expensive digital filing cabinets that end up being their system of record, right? So now we can kind of break that open, and it doesn't have to be broken open and you just have one new player. We believe that we want to bring in all the players, really create that ecosystem. So that's just at a high level. Microsoft is a partner first platform company. Now, when you dig a little bit deeper into the clinician specific space, we really do think that intelligence will be abundant. It'll be accessible. It'll be affordable. It has to be at the right place at the right time in the workflow. That's how we're approaching sort of the physician, the radiologist, the nurse, and on and on and on for other personas in the health system. For nursing specifically, since, that's where we've just been talking about, to go even another level of detail, our vision for nurses is their eyes free and their hands free, right? They can be talking to you, touching you, examining you, and the technology is just fading into the background. It's doing all the things, but it's not getting in between me and my patient, right? So imagine a mobile first, smart room native, built for where the nurse is working and how that nurse works. And it doesn't have to be where the EHR is. That's our vision.
As a leader in the space, with the clinical background you've had and you've been able to see so many different aspects of things, what's your advice to fellow leaders in this space? Maybe they're on the clinical side, maybe they're not, but they're just trying to not only stay caught up, but they're trying to provide some of that vision and help people see what is the most beneficial to all the players here involved. What's your advice to your colleagues?
So if I'm talking to a health system leader, I would say, and this is a bit of my advocacy coming out, when you look at the largest part of your operational spend, your largest labor force are nurses. So what are you doing for your nurses? Are they in the room when decisions are being made? Are they part of the design? Are they part of the change management? Are they part of the implementation planning? Do you have budget for AI and solutions for them? Because they've been your front line. They've been here through a lot, and we have an opportunity to make their shift, the outcomes, their experience materially better. This is a very consequential time right now. So really think about what are solutions that really enable them to be the best nurses they can be so that your patients get the best care that they can get, and invest in that relationship that the nurse has with the patient. I think the other thing for people who are choosing sort of what technologies and, sort of how do you choose, you really want to think about measuring what matters, right? Because at the end of the day, and we all know this, we should not be engaging in tech just for tech's sake. And I know it's a super AI buzzword and everybody feels like they need to be using AI, but you need to make sure it's pointed to, like I said, we went and we watched the nurses and we said, oh my gosh, we got to figure out documentation, right? So because we started with what did we want to resolve or augment for a day in the life of that nurse, and then think about the tech. And then on the flip side, so are we doing that, right? Like what is the measurement for those outcomes? So what outcomes are you pursuing? Start from there and go backwards. The third one, if you've already made your selection, is change management. It's not a check the box at the end. It has to be all the way through. It has to be a process. You have to invite in the people, the users that you are actually wanting to give these solutions to, have them become part of the design around the change management. And just wearing my Microsoft hat, kind of the way that we think about it, we are at this amazing precipice, right? Where we're going to see so much change. We're already seeing it, and we're still at the early innings, right? We're already seeing so much change. So I would just say, for us, the way that we think about this is we think about AI, and health systems should think about this too. You should think about AI scaling at the speed of trust. You can unpack trust in a lot of different ways, like what is your governance? What is your security? What is your ethics? What is, sort of your guardrails, clinical guardrails, all of those things. But, you need to make sure that you're building to a very robust position on trust, because that is where the rubber really meets the road to really get to adoption and scale.
Very good. Thanks for giving us so much to think about, and for joining us today, and for everything you're doing to improve healthcare, and look forward to keeping in touch. And yeah, I would love to have you back in the near future and dive even deeper into some of these things. We have a lot more to talk about.
Thanks, Jared. It was a pleasure.